Hi everyone, this is my fetal well-being assessment assignment and it's on cervical length. I'm Bridget Irving. Measurement of cervical length. There are essentially four methods that can be used to evaluate the uterine cervix: digital examination, transabdominal ultrasound, transperineal ultrasound, and transvaginal ultrasound. The test that we will be focusing on is the transvaginal ultrasound. A transvaginal ultrasound is able to visualize cervical tissue and display its anatomy, making this the ideal method of measurement. It is performed within the second trimester between 20 to 24 weeks. A transvaginal ultrasound will visualize the cervix and allow for measurement in millimeters by the provider. History of the test. The test is performed in an effort to prevent spontaneous preterm births. Research from Markham and Imes describes that an important step toward the goal of eliminating spontaneous preterm birth was realized with the use of cervical sonography. Cervical sonography has improved the ability to detect women who are at risk for early delivery and has allowed for prevention of some of these premature births. Current research shows that preterm delivery is a leading cause of infant mortality and morbidity, and it is estimated that annually about 15 million infants are born preterm worldwide. Preterm is considered birth before 37 weeks. Recommendations that support this test. Although universal cervical length screening has proven to be cost-effective, it still has not been accepted as a part of routine antenatal care. Iro et al. Writes that measurement of cervical length aids in early detection of patients who are likely to go into preterm labor and identification of high-risk groups. This screening should be performed for both high-risk and low-risk women in mid-pregnancy whenever possible. As mentioned before, the major indication and purpose of this test is to screen for preterm delivery in an effort to prevent spontaneous preterm birth. Cervical length can also be used to distinguish between true and false labor. Who is screened? Pregnancies that are at high risk because of obstetric history, such as history of second trimester miscarriage and/or preterm delivery. History of congenital uterine anomaly or cervical surgery. Contraindications for performing the test include preterm, pre-labor rupture of membranes, women with cervical circlage, women with multifetal reduction, and women with placenta previa. These are circumstances in which transvaginal ultrasound should be avoided. Standard technique for the procedure includes having the client empty their bladder. Women are then placed in the dorsal lithotomy position, and the transducer is inserted into the anterior vaginal fornix. The cervix is visualized in the longitudinal plane, and the endocervical mucosa is identified, and cervical length is measured as the distance from the internal os to the external os. This examination should only be about 3 to 5 minutes. At least 3 measurements should be obtained during the examination, and the shortest measurement should be used for counseling. Advantages to performing this test is prevention of preterm delivery complications. Babies that are born preterm may suffer from learning disabilities, visual and hearing impairments, cognitive disorders, behavioral problems, and cerebral palsy. Disadvantages: I was unable to find any clear disadvantages. Interpretation of results. Normal cervical length measurement findings are values of greater than 25 millimeters. These are expected and favorable findings. Routine screening is also not advised beyond 24 weeks of gestation in asymptomatic women. Abnormal cervical length measurement findings are values of less than or equal to 25 millimeters. These clients are considered at relative risk for spontaneous preterm birth. In order to follow up properly, we must monitor closely for other signs of preterm labor and treat where indicated. Very abnormal cervical length measurement findings are values of 15 millimeters or less. These clients are deemed high-risk patients. These patients need to be admitted to the hospital and treated per protocol. These clients' babies typically end up in the NICU following a preterm birth. However, follow-up for high-risk patients may include the use of progesterone injections or progesterone gels to prevent preterm birth. Treatment will be based off of a comprehensive assessment performed by the provider. This is a figure of a transvaginal ultrasound of a normal cervix. The yellow double-headed arrow illustrates the most commonly used method of cervical length measurement. This is a figure of a transvaginal ultrasound. During the transvaginal ultrasound, the provider or medical technician inserts a device, the transducer, into the vagina while the client lies supine on the exam table. When performing any procedure, it is appropriate to keep the client fully informed of the information about what will be happening and why. Our text by Engstrom stresses the importance of providing the most comfortable experience as possible for the client. Prenatal ultrasound teaching points includes the above. Iro et al. Concludes that transvaginal ultrasonography is a simple, safe, non-invasive procedure for exact measurement of cervical length. We would educate the patient regarding the purpose of the examination, how and where it will be done, exploration of payment considerations, and preparation for the exam. We will explain who will perform the ultrasound and whether or not that person can provide in-time information on results, qualifications of the sonographer, anticipated and potential results, with an explanation of further plan of care, method and anticipated time of communicating results, a woman's right to view the screen and to have a chaperone present, and the presentation of choice for anomaly and genetic screening ultrasounds will all be discussed with the client at the appointment. References.